Good morning, everyone. We're just going to wait a couple of minutes to let everyone log on, and then we'll start shortly. All right, everyone, let's get started. So good morning. My name is Monique Yabsley, and I am one of the neurological occupational therapists here at Advanced Rehab Centre. Today, we are going to talk about overcoming cognitive changes after a stroke. So today's objectives are increasing your knowledge on what cognition is, what can change in your brain structures following a stroke, and what the best ways to manage cognitive changes are. What is cognition? Cognition is a word that you all would have heard a lot of during your recovery. I have found that a lot of individuals have disclosed to me that they are seeing and feeling cognitive changes within themselves, however, don't have a great understanding of what that actually means and how it may be affecting their day-to-day lives. I'm hoping that today you will all leave with a greater understanding of what cognition is and how to manage your cognitive changes following a stroke. So, what is cognition? Cognition is defined as the mental action or process of acquiring knowledge and understanding through thought, experience, and the senses. Cognition involves attention, concentration, perception, memory, communication, problem solving, awareness, and planning, just to name a few. Every second that you're awake, you receive a huge amount of information from the world around you, which your brain has to understand, organize, and keep. Cognition involves not only the things that go on inside our heads, but also how these thoughts and mental processes influence our actions. Cognitive functioning is in everything that we do. Breaking down everyday tasks will allow you to see how our brain is constantly working on carrying out a task. So, for example, answering the phone involves multiple steps. It involves perception, hearing the phone ring, decision making, deciding whether to answer or not, motor skills, lifting the phone to your ear, language skills, talking and understanding what is being said, and social skills, interpreting tone of voice and interacting in a correct manner. These may have been automatic responses prior to your stroke, where now you are needing to concentrate more on this daily process. Different parts of your brain control different things. If one of the parts of your brain that controls cognition is damaged by a stroke, then this can affect your ability to do certain things. If your cognition is affected, then you could find it difficult to concentrate or remember certain things. You may also find it difficult to work out how to do something or know how to respond to what is going on around you. Some cognitive changes that you or your loved ones may have noticed following a stroke could include forgetting things more often, losing your train of thought during conversation or difficulty with word finding, feeling increasingly overwhelmed or confused with decision making, planning steps to accomplish a task, or understanding instructions, difficulty navigating your way around familiar environments, being more impulsive or showing poor judgment, as well as irritability and aggression. The hierarchy of cognition explains the components involved in being able to perform any task. Information processing is considered to be a core foundational domain of functioning within a hierarchy of cognition, and information processing skills, such as processing speed and attention, underlie and support higher cognitive abilities, including working memory, verbal and visual memory, and executive function. Changes at the foundational level may have a direct bottom-up effect on more complex levels of functioning. So we will go through each domain to gain a greater understanding of how each concept plays an important part in our everyday functioning. Processing speed. So processing speed is at the base of the hierarchy. Do you ever feel like you're zoning out or becoming confused when someone is giving you new information? You may be experiencing difficulties with your processing speed. Processing speed involves the time required to respond and process information in one's environment. It involves the input of information and is closely paired with decision making. Whenever people make any type of decisions, it involves making judgments about things that they have processed. It might involve comparing new information to prior knowledge, integrating new information into existing ideas, or even replacing old knowledge with new knowledge before making a choice. So some examples of things you might be experiencing with processing speed difficulties are difficulties thinking on your feet, having to do tasks slower in order to understand them, getting tired when a lot of information is being said at one time, difficulty listening and retaining information in a busy or loud environment, difficulty understanding new information, difficulty making a decision or choice based off that new information, as well as difficulty following step-by-step information. Attention and concentration. Do you find you are getting distracted easily and are having trouble focusing on any activity? You may be experiencing changes in your attention and concentration. Attention is a cognitive process that allows people to focus on a specific stimulus in the environment. Our attention to the world around us, memories of past events, understanding of language, judgments of how the world works, and abilities to solve problems all contribute to how we behave and interact with our surrounding environment. So there are 4 types of forms of attention. First one is sustained attention, and this is focusing on a specific task for a continuous amount of time without getting distracted. We have selective attention, selecting a task from many factors or stimuli, then to focus on only the one chosen task while filtering out distractions. Alternating attention, the ability to switch focus back and forth between tasks that require different cognitive demands. And then lastly, divided attention, often referred to as multitasking. So that's the ability to process two or more responses or demands simultaneously. So some examples of things you may be experiencing day to day with attention and concentration difficulties are being easily distracted, confused when there is a lot going on, difficulty with multitasking, finding attention is wandering more easily and more frequently, getting mentally fatigued and tired after doing small tasks, needing more prompting from friends and family to continue with the task, feeling spaced out or blank, and losing track in the middle of a conversation. Working memory. Do you find you are forgetting where you are leaving your belongings around the house? This may be related to your working memory. Memory is an important cognitive process that allows people to encode, store, and retrieve information. Working memory has the ability to retain new facts, recognition of previous experiences, and allows us to compare perceptions formed in the present with information remembered from the past. So while people often think of memory being much like a video camera, carefully recording and cataloging life events and storing them away for later recall, memory is actually much more complex than that. Forming memories involves multiple structures of the brain with a multi-step cognitive process just to form a new memory. So some changes you may be experiencing with your memory: forgetting people's names and faces, difficulty remembering where you have put things in your home, remembering where things are usually kept, remembering what you've said to someone when talking, repeating yourself in conversation and throughout the day, having difficulty learning a new skill, and then forgetting steps in a daily routine. Perception. Are you finding you are having trouble deciding what type of clothing to wear each day? You may be experiencing some perceptual changes. Perception is a cognitive process that allows people to take in information through their senses and then utilize this information to respond and interact with the world. Your brain processes messages from your senses. So I'm sure you all would have heard of the 5 senses. So that is smell, touch, taste, sight, and hearing. You might be having difficulty with sensation. So not feeling touch or pain, heat or cold on the side of your body that is affected by your stroke. As well as recognition, not recognizing shapes, objects, or even parts of your own body. Vision, half of your vision in each eye is lost. Neglect, not seeing or feeling things on your affected side. So this can make day-to-day tasks difficult through having difficulty determining what clothing to wear each day. So for example, difficulty identifying if it's hot or cold outside, if you should be wearing long pants or shorts, or taking a jacket when you're leaving the home. This could also be getting confused by daily objects. For example, using a toothbrush to brush your hair. Lastly, not scanning your full environment and finding yourself bumping into objects or tripping over things more often. Learning and memory. Are you finding it is taking longer to learn a new task or retain new information? This may be as a result of changes with learning and memory. Learning requires cognitive processes involved in taking in a new thing, synthesizing information, and integrating it with prior knowledge. Learning involves being able to take in new information, form new memories, and make connections with other things that you already know. Memory is a critical component in the learning process and allows people to retain knowledge. Difficulties with learning may look like being unable to learn a new task without constant prompting, not understanding new instructions, being inflexible due to difficulty with new situations, and difficulty maintaining employment or work. Problem solving. Are you finding it hard to think of solutions to everyday tasks? Your problem solving skills may be the reason why. The process of finding solutions to difficult or complex issues involve a four-step process. Number one, defining the problem. Number two, generating alternative solutions. Number three, evaluating and selecting an alternative. And then number four, implementing the solution. So this is a multi-step process that can be difficult when managing cognitive changes. Some things that may be difficult are working out how to do certain things. This could be a task that seems quite simple, like changing the channel on the TV remote, or it could be more complicated, like making a meal. Planning how to complete a task. You may not be able to think of all of the steps that are needed to do something, such as making a cup of tea, or put the steps in the correct order. Begin or finish a task on your own. You may not realize that you need to do something like get dressed until someone tells you you need to, or you may need someone to prompt you. Solving problems on your own. You may not be able to work out what to do if something goes wrong. And at the very top of the pyramid, we have executive functioning. So executive functioning involves flexibility, anticipation, problem solving, so defining the problem in the right way to then generate solutions to pick the right one. Decision making, the ability to make a decision based on problem solving, on incomplete information, and on emotions. Emotions being yours and others. Working memory, emotional and self-regulation, which is the ability to identify and manage one's own emotions for good performance. Sequencing, breaking down complex actions into manageable units and prioritizing them in the right order. And inhibition, the ability to withstand distraction and internal urges. So things that you might be finding difficult at the moment are completing the full process of a task. So for example, that could be reading a recipe, being able to follow the instructions, multitasking between different pots and cooking times, as well as maintaining your safety in the kitchen. Planning or organizing things, following a routine, generating ideas and solutions to problems, managing your personal time, as well as adjusting to unexpected things throughout the day. While changes in the structures of the brain following a stroke contribute to cognitive changes, other factors can also contribute and exacerbate these cognitive changes. So these include depression and anxiety, fatigue, pain, some medications that you may be taking, your own self-esteem, motivation, and mood. Okay, so a quick anatomy lesson. Often after the diagnosis of a stroke, you will be told the location of your stroke and that there have been some damages to these areas. However, you are unsure what those structures and locations actually control. Hence, not knowing the type of physical and cognitive deficits you may experience in your day-to-day life. We are now going to have a quick anatomy lesson on the brain to hopefully gain a greater understanding of what all of the structures in the brain control in relation to cognition and cognitive functioning. The frontal lobe. The frontal lobe is the frontmost part of your brain. It's responsible for controlling many abilities, including the way you think, how you move, how you remember things. It's also a key part in your social skills and helps you understand and control how you talk, behave, and interact with others. The frontal lobe is largely where your personality is developed. Damage to this lobe can result in personality changes, impulsivity, difficulty concentrating or planning, difficulty with short-term memory, difficulty initiating tasks and executing them, reasoning skills, emotional changes, sometimes resulting in a lack of empathy. The Broca's area. The Broca's area is in control of speech production. Damage to this area can result in expressive aphasia. This means that there is a breakdown between one's thoughts and one's language abilities. Individuals often feel they know what they wish to say, but are unable to produce the words. As a result, they are unable to translate their mental images and representations into words, as well as difficulty with word finding during conversation, causing great frustration to the individual. Hesitant and fragmented speech with little grammatical structure. Next, we have the temporal lobe. The temporal lobe is an area inside your skull, near your temples and ears. It is most commonly associated with processing auditory information and with the encoding of memory. The temporal lobe plays a role in managing your emotions, processing information from all of your senses, storing and retrieving your memories, mainly your long-term memories, and understanding language. It's also involved in some unconscious and automatic responses, such as hunger, thirst, fight or flight response, emotions, and sexual arousal. Damage to this area can result in difficulty recalling visual stimuli. This is not due to poor vision, but rather the inability to interpret what is being seen. This can result in difficulty identifying familiar objects, as well as reduced long-term memory, so not being able to recall events from the past, reduced auditory hearing, sometimes auditory hallucinations, so that's thinking you're hearing something when you're not, disturbances in learning, so difficulty retaining information, and difficulty understanding what you're hearing when being spoken to. The occipital lobe. The occipital lobe is the vision center of the brain. It is the analysis of visual information seen from your eyes to your brain. This includes color, shape, and form. The occipital lobes are also associated with various behaviors and functions that include visual recognition, visual attention, and spatial analysis. Injury to the occipital lobe may lead to vision impairments such as blindness or blind spots, visual distortions, and visual inattention. Other examples include difficulty with locating objects in environments. So that could be wanting to find your shoes in a cupboard full of other shoes and not being able to see them, difficulty scanning the environment, and difficulty maintaining eye contact and an inability to gaze. The parietal lobe. Your brain's parietal lobe is a key part of your understanding of the world around you. It processes your sense of touch and assembles input from other senses into a form you can use. Your parietal lobe also helps you understand where you are in relation to other things that your senses are picking up around you. The parietal lobe controls your perception, spatial awareness, manipulation of objects, and spelling. The somatosensory system is also located in the parietal lobe and is the part of the brain that receives and processes sensory information from your entire body. Damage to this area can result in difficulty knowing where your body is in space. This often results into tripping over your own feet or bumping into things all the time, as well as temperature discrepancies, not knowing if something is hot or cold, so this can transfer into touching hot plates and having no effect. Lower or higher sensitivity to touch or changes in feeling on the skin. So for example, thinking something smooth is rough and vice versa. Higher or lower pain thresholds, spatial orientation and judgment. This can be dangerous if one is still driving. This involves the judgment of distance between objects and space. The Wernicke's area. The Wernicke's area of the brain is the area that contains motor neurons involved in comprehension of speech. Damage to the Wernicke's area can lead to disorders associated with speech and language, such as aphasia. This condition causes difficulty with understanding language and forming meaningful sentences. This can result in difficulty holding or maintaining a conversation. This can result in becoming socially withdrawn and not wanting to engage in verbal conversation, not understanding verbal instructions, and confusion. So arteries in the brain. Blood in the brain is supplied by two pairs of large arteries, the carotid artery and the vertebral artery. At the base of the brain, these two arteries join together to form the circle of Willis. This is a circle of arteries that provide many paths for blood supply and oxygen to the brain. The types of deficits you may be experiencing following your stroke is largely based on the location in the arteries. So you're probably all thinking, well, that's well and good to know what structures of the brain control what and examples of what cognitive changes I may have. But what does this all mean for everyday life and how can I manage these changes? Well, lucky for you all, we are going to go through a step-by-step strategy for each domain in the cognitive hierarchy. Okay, so strategies for processing speed. I thought it may be best to break down processing speed into common problems and discuss strategies for each. So the first one is getting frustrated when completing a task that is challenging. So some strategies could be taking a short break and coming back to the task. Finding a quiet environment or an environment that is calm to complete that task. Asking for help or guidance, and visual or verbal prompting from your loved ones or your supports. Another example is getting overwhelmed and flustered when being asked a question. So some strategies for that could be asking them to repeat the question, requesting they talk slower or in layman terms, taking a deep breath and trying to think about the potential answer, as well as asking for help if you feel you need it. Simply telling the person you are not sure, it is okay to always not know the answer. Difficulty understanding new information or difficulty making a decision or choice based off that new information. So a good strategy for that could be writing the information down to refer back to, asking for guidance and or a demonstration. Go through the step-by-step process. Start with trying to make associations with previously learnt information. If unsure what a safe option is, ask for help. Strategies for attention. So sustained attention, we have an example for. Difficulty concentrating and becoming distracted when trying to focus on a task. Strategies for this would be having a short break and coming back to the task. So that break could look like going for a little walk, doing some mindfulness therapy to give your brain and your thought center a break. Reduce internal and external distractions. So for example, sitting in a quiet room and then not getting frustrated with yourself if you're having difficulty concentrating. Picking a task that is enjoyable to you to build up tolerance for maintaining attention. Selective attention. Difficulty focusing on verbal instructions or on information given. Writing down notes and the instructions that are given. Repeating the instructions back to double check all information was gained. Introduce self-talk motivation. So telling yourself, I need to stay focused and look at the person talking to me. Ask for videos of the person explaining the instructions and then replay them as prompts. Ask for a physical demonstration to gain a greater understanding. Divided attention, completing multiple tasks at once. So some strategies for this could be making a checklist and ticking off when the task is completed, double checking your work. I would always recommend just focusing on one task at a time, prioritizing your task. So sitting down and mapping out which one's the most important to get done first, and avoid background distractions. So avoid having the TV on in the background, people talking around you, or the temptation of looking at your phone, putting that in another room. Strategies for memory impairment. So difficulty remembering everyday activities. So for example, that could be brushing your teeth, difficulty following a routine. So visual or written routine with a checklist. So ticking things off once complete. Keeping a calendar, either paper-based or on mobile phone. Step-by-step cues of the task in the environment that the task is performed in. So for example, step-by-step analysis of brushing teeth and having that position on the bathroom mirror, sequencing of getting dressed, having that sitting on the wardrobe there, repetition and following the same morning and evening routine to build a new habit. So getting up at the same time each morning, having breakfast at the same time, having a shower, doing all of the things in the same order each day to learn that new habit. Daily planner, writing down all the things that you need to be done for the day. Getting a Webster's medication pack to remind you to take your medication at different times of the day and avoid the cognitive process of needing to figure out which ones at which time. Setting alarms, particularly when cooking, and then using a graded approach. Once the task is learnt, reduce those prompting cues. Strategies for problem solving. Having the 4 steps of the problem solving written down to refer back to when the process of problem solving is happening. So having those 4 steps there and having an answer next to them while you map it out. Or using a mind map, writing down all potential options, asking your supports or loved ones for hints and trying to solve the rest on your own. Reflection on the problem and how you would solve it again in the future. Writing down solutions to daily problems that may arise to refer back to. Brainstorming problem solving for everyday tasks. Minimizing high cognitive problem solving in everyday activities. Create a predictable environment. Practice asking for help and guidance, particularly when in the community. Strategies for executive functioning. This could look like creating a routine and following all the steps involved. Cooking meals or following a recipe that does not involve too much multitasking. Set the environment up for success. Get all of the utensils and ingredients out first, then following instructions step by step to avoid having to go back and forth in the kitchen. Mapping out a trip into the community and having a loved one check the route first before heading there yourself. Finding tasks that are enjoyable and in line with interests. Modifying the task demands to reduce time pressure and fatigue. So that could look like picking the time of day when you're feeling your best self. Positive reinforcement, both internal and external. So telling yourself that you're doing a good job and your supports and loved ones providing that positive reinforcement as well. Okay, so today's takeaway message is that everyone is on their own cognitive journey. Experiencing cognitive changes following a stroke is very common and can be managed through implementing the above strategies into everyday life. It is important to be kind and patient with yourself every day. I also wanted to share some tips for friends and family of people experiencing cognitive changes post-stroke. So tips for the friends and family: being patient, being encouraging, Give information in the right way. So clear prompting, step-by-step information. Don't do everything for them. So provide them with opportunities to try and problem solve first. And then get them help and support when needed. I can imagine this presentation was information overload and that you're all going to need to have a big relax following this presentation. Cognition and cognitive functioning is different for everyone. You may have learnt new things about yourself during this presentation, or if you've been struggling for some time and are wishing for some more guidance on strategies, here at Advanced Rehab Centre, the occupational therapists are trained in cognitive therapy. We complete cognitive assessments to uncover the areas of cognition that are affected and then work with you to create an individualized cognitive therapy program. This can include sessions in the clinic or sessions at home if you find that more comfortable. If you're wishing to book in an appointment or find out more details, please don't hesitate to reach out on the number below. Okay, so now we're going to open up to some questions. I see there's a chat up here. Let me just have a quick look. Okay, someone's had to duck off early. That's okay. So if you guys would like to ask some questions, that would be great. You can put them in the chat box or you can just shout out. So the question here was, are we able to access this recording? Absolutely. It's going to be uploaded to the Academy website, and you'll have full access to watch this back as many times as you would like. And someone has asked, is it possible for someone to redevelop full work capacity after a stroke? That's a really great question. That would depend on the level of impairment at the moment. We definitely have a lot of individuals that we see here return to work, whether that be in the normal capacity or in a different role. If you'd like to look a little bit more into that, I'm more than happy to have a conversation with you. I have my email. I'm just going to change the slide here. So I've just popped my email at the bottom there. So if you'd like to reach out and have a conversation about your work, some of the things that you're having difficulty with, I'd be more than happy to chat to you about what that might look like returning back to work. Another question here. Does the hierarchy mean that someone could experience executive function higher on the hierarchy, but not experiencing processing speed difficulty? Yeah, absolutely. So there isn't really a one size fits all for cognition. Sometimes people might be having difficulty at the higher level, somewhere in the middle or on the lower level. Generally, just how cognition is mapped out is they're the foundations to achieve the executive functioning skills. So you could be experiencing levels on any different level of that hierarchy there. Wait another couple of minutes if anyone would like to ask any more questions. You're welcome. What tests are available to test and check executive functions? So there are lots of different cognitive assessments here. It would be dependent on the areas that you're having most difficulty. So you've got cognitive assessments that assess specific areas. So that could be lower level cognition, or that could be bigger picture cognition, wanting to transfer back into the workplace. It would be dependent on the level of cognition that the individual has as to which assessment we would choose. All right, guys, do we have any other questions today? No, thank you. That's great, David. I'm glad you've learned something. I hope you've all had something to take away from here. I can imagine you're going to need a rest now. So everyone take a bit of a break and have a relax. And I'm sure I'll see some of you guys soon. Okay. Thank you very much for your time. Take care.